All right.
All right, I'm a firm believer in starting meetings on time. Dr. Jahanger, this is the February 11th, 2021 Board of Health meeting. Here's your 5-second lead-in. 5.
Hold on. Are you calling the meeting to order? Is that what I hear you saying?
I'm going to start the meeting. Yes, it's 4 o'clock, right?
It's 4 o'clock. Hold on a second. I just want to make sure we got everyone. So Calvin is there, Tom, Tanae, is Carol here?
Yes, I'm here, but I can't, Joe. Yeah. I can't.
And did I hear David there too?
I am here. I'm having trouble getting in.
Okay. As long as we're all physically here.
I'm physically here. Yeah.
Great. Great. All right. Well, if everyone's here, then let's go. It's 4 o'clock. Let's do it, sir. And Miss Lester's here, and is Dr. Wright joining us?
One second. We got. Where's your video at?
Did you log on to the panelist?
I'm behind Tina.
He's here.
All right. Oh yeah, there you are. That's funny.
Are you in?
It told me to download a temporary application, and it takes time, but I can listen. I can hear.
All right. Yeah, I think we're good. If we'll get started, and then we'll go like we normally do.
Dr. Jahanger, here we go. Try it again. All right. Board of Health meeting, February 11th, 2021. Here's your 5-second lead-in. 5, 4, 3.
Good evening or afternoon. So welcome to the Board of Health meeting for February 11th, 2021. I call the meeting to order. First item on the agenda is a motion to approve and conduct electronic meetings. And would anyone like to read a motion? And yes, Ms. Franklin.
I move that the items on the meeting agenda constitute essential business of this board. Meeting electronically is necessary to protect the health, safety, and welfare of Tennesseans considering the COVID-19 outbreak, and any conflicting with the governor's executive order permitting electronic meetings be suspended.
Great. Thank you for that motion. Is there a second to that?
Seconded.
Thank you, Dr. Smith. Do a roll call count. Ms. Franklin.
Aye.
Dr. Smith.
Aye.
Ms. Etherington.
Aye.
Mr. Frederick.
Aye.
Dr. Campbell, excuse me.
Yes.
And I also. All right, that carries. Thank you so much. Next topic on the agenda is a discussion around the. Sorry, I keep looking this way. I'm trying to save paper, so I'm not actually paying attention. I'm looking at my screen here. Is a consideration of extension of public health emergency declaration. As you may remember, last board meeting we extended it till the end of April, which is essentially a 3-month lead time. I believe that has worked out better for the purposes, and I see Tom Sharp shaking his head. So what I would like to do is if one of you would be willing to, just make a motion to extend another month, and we'll continue doing it as such to give that 3-month lead time for our team to operate. I've heard positive from both the business community as well as our colleagues here at Health. So with that said, any discussion, I'd love to, if somebody would like to make a motion or anything like that.
Motion to extend the public health emergency declaration for another month.
All right. Until the end of, that'll be until May 31st.
Correct. Until May 31st.
Okay. Be a second to that?
Second.
Great. Thank you. I'll take Dr. Campbell since it's verbal. Any discussion around that? All right. Hearing none. Ms. Franklin?
Aye.
Dr. Smith?
Aye.
Ms. Etherington?
Aye.
Mr. Frederick?
Aye.
And Dr. Campbell?
Aye.
Great. Motion carries. Thank you. Meetings from the January 14th meeting were circulated. Any discussion around those?
Move to
Hearing
approve.
none. Thank you, Ms. Etherington. Move to approve. Is there a second?
Seconded.
All right, Dr. Smith, I heard you first. All right, Ms. Franklin, this is to vote. This is to approve these. Ms. Franklin, Dr. Smith,
Aye.
Ms. Etherington,
Aye.
Mr. Frederick,
Aye.
And Dr. Campbell.
Aye.
I also concur. Alrighty, next item on the agenda is an update from our friends at MAC and what a year it's been. So are they, I see Mr. Dice's thing up here. I see, there you are. Hey.
Hello, everyone. How are y'all?
Doing well. Thank you for joining us virtually this time. Please, the floor is yours.
Absolutely. Thank you. And we definitely appreciate time on the agenda today. We know there is lots going on and lots to discuss. So we appreciate having the opportunity to drop in and share a little bit about Friends of MAC. For those of you who don't know me, my name is Brandon Dice, and I am a longtime volunteer at MAC and also the chair of the board for Friends of MAC, which is the nonprofit we started a few years ago to support the shelter. So I think I have the ability to share my screen. And if I can, and I will not take up too much time today, so we'll certainly get through this presentation pretty quickly and then obviously open the floor up for any questions. But just really quickly, a little about what our year looked like in 2020. Sort of the theme we have is Rescue Together, because as we know, 2020 threw us definitely a curveball, and so it was definitely a combination of relying on our rescue partners, on our community for all the work that we did in saving more lives here in Nashville. So just really quickly, we'll walk through 2020, look ahead at 2021, and then how we hope to accomplish all our goals together. But just really quickly, last year, I'll share a little bit about our financial performance, our tornado response, our COVID-19 response, and then sort of the big contribution to the shelter itself this year was remodeling the play yards, which was a little over 4,400 square feet of outdoor space. But just a quick look at our numbers. And at any point, if anyone has any questions, please chime in or let me know. But our total income last year was a little over $93,000. If you compare that to the year before, we were just off by about 1.5%. We were pretty excited about that number in that, in 2019, we had lots of in-person events. We had tons of events planned for 2020, but obviously we didn't get to do those. So the fact that we basically stayed on par with the year prior in a virtual, and remote setting, really for us kind of affirmed the value that folks see the work that MAC is doing in our community and wanted to step up and support that. So we were very pleased with our fundraising efforts. Then total contributions to the shelter, right at $70,000, and I'll outline some of those costs here on these slides going forward. We do have about 16,000 remaining, and then our operating expense was 10%. That was a little higher than we wanted it to be, but we were gifted, and we'll talk about this in a little bit. We were gifted an RV, a mobile transport unit, which is fantastic from Mutt Nation. But it did need just a little TLC, and then they did contribute funds to cover to that, but to add to that, but that did go onto the operating line. So unfortunately, so that ended up being a little bit higher than we wanted it to be, but we know it's going to be a worthy investment. So any questions on financials? I'll just keep rolling along. So tornado and COVID response. Obviously, the community needed us last year more than ever in terms of a response to the tornado. When that happened, there was a line of cars that first Saturday, literally out onto Harding Pike, where folks lined up to make donations. So we used funds, about $6,000, to purchase a storage shed, which you can see the inside there, just to house all the extra supplies that were coming in, because the inside of the shelter in the Bay Area was at capacity and there was no great place to store the food securely. So we expanded the capacity of the pet pantry by providing the storage shed. We organized it multiple times because we did tons of outreach to the community in terms of, obviously, lots of folks needed that nutritional assistance for their families, for their pets. So we kept organizing it to make sure the most dated food went out first. We set up a contactless food delivery in the summer. So we delivered about 3,000 pounds of food to 150 families who had called the shelter needing that, but did not have transportation or means to get to the shelter. So we dropped it off on their front porches. And then we were very proud. We partnered with Second Harvest Food Bank to host 2 mobile pop-up food pantries. And that Sarah, you can see her in the flyer there in the bottom corner. That was out at DuPont Tyler Middle School. And then we served about 300 families through that event. So again, this was the big ticket item. So you can see the bottom there, the back play yards at Mac, if you'd ever been over there, they were a little unwieldy. They just tons of use from dogs, wear and tear from volunteers and time. So we decided to make those. As you can see, they were horrible, and you would never even want to be back there really. So we invested in remodeling that space. You can see the big play yard at the top. That ended up being about a $30,000 investment. So that's where the bulk, about half of what we spent went. But now that space we feel is usable in any weather, which is great for the dogs and also to visitors for the shelter, so that we have that outdoor space to accommodate our guests and volunteers. So those were the big ticket items. Sort of the highlights from last year. So where are we going in the year ahead? We definitely want to continue supporting the safety net program, the foster program, which has been a tremendous help in our ability to intake and save more lives in the community, then our emergency medical fund, and then also our Humane Education program, which we had planned for the year, this past year, but kind of COVID again sidelined us just a little bit. But for the safety net program, we did contribute $20,000 to that program last year through a grant through the SAFE Coalition. This year, we're looking at providing $22,000 for a pet-friendly housing fund. So we know there are folks in our community that are facing, displacement, relocation, and sometimes it's a matter of finding that housing and having the funds to cover, a pet deposit. So we do know that there are families that have had to surrender at the shelter because they did not have that pet deposit. So we're going to work closely with Sarah Spadavecchia, who's the safety net coordinator, and we are going to provide that assistance to families so that if it's just a matter of being able to afford the pet housing fund or pet deposit, that those families can stay together. So those, we're looking at those average around $200. So we're anticipating helping a little more than 100 families through that initiative. Foster program support. We know the MAC has a big emphasis on growing this program to keep healthy animals, in foster homes, and also keep that space preserved at the shelter. So we certainly want to support them in growing that program. So we're going to look to provide some additional resources there, just so that foster families have all that they need to keep those animals, and that they have a wonderful experience and want to continue fostering for the shelter. Emergency medical fund, this one speaks for itself. This is, we supported this program last year at the same amount, so we're going to keep that. Again, those are about the dollars that it takes every year for the animals that we see, and this is really just for the awesome medical team. Sometimes animals come in that need care beyond the services that are available immediately at the shelter, so this allows us to take them out to partner facilities for x-rays or for other maybe procedures, again, that can't be performed in the shelter. Then Humane Education, we look at this being a big one. We're partnering with our ACOs, our animal control officers. One of the big focuses for Friends of MAC is to get MAC out into the community and help really showcase and educate folks on all the amazing programs that are available to them. So this is our opportunity to work with our ACOs, members of the community, to really take those services out there and help folks, know what's available to them. So we say those are sort of the four big focus areas for 2021. So we're going to try to have some fun while saving lives. The first is the Whisker and Wolf Wagon. Then we do have a few events planned, and then also our fundraising goals for the year. But if you see there is the RV that was gifted to us. We're in the process. It's been detailed, rebuilt a lot on the inside. We're adding some branding to the outside of it. But really, we'll look at this as an opportunity to help build partnerships, support our foster families, put together that humane education program, but then also, should time allow, or things go that way, that if there are community events, we can certainly go and participate in some of those types of events to get MAC out there. And just fundraising, we are looking at hosting a few virtual events this year. So we'll have those. We are in discussion with Pet Community Center on partnering for a telethon, maybe June timeframe. That has not been booked yet, but we are in discussion to have that. That would be a big fundraising initiative. And again, we realize that in-person events are going to be limited this year, especially through certainly the first half of the year. So this is an opportunity really to be more virtual, or try to reach more folks in that remote setting. And then hopefully toward the end of the year, there may be the opportunity to go out and have small events. Certainly, we take all our cues from Lauren and the team at Max, and never would we host an event without their input or their permission. So we would always certainly defer to Max and the health department's judgment on that. So, but again, hoping, our fingers are crossed that maybe toward the end of the year, there may be the option to do some outdoor type style events. So just our 2021 projections, individual donors, that is roughly what that's the dollar amount that we typically have averaged for the last 2 years. So, surely, hoping to keep that flat. Corporate donors, and then our events from the slide before, if all of those come to fruition, and then possibly looking at adding a few grants into the mix. But our total income for the year, if we hit all our goals, which we will, would be 110. We have about 50 in carryover. But then if you back out the expenses of the Humane Education, the Pet Housing Fund, the foster program, emergency medical, and then what we projected for our operating costs, we're looking at for the organization, it would be about $80,000. And then just really quickly, these are our board members. We did have our first year where we had board members transition off, the new board members transition in. So this is our new roster of board members. Shelley Bankard Weaver is now our vice chair. She is new this year. And then Melody Keefe is our treasurer. But those other faces should be pretty familiar from years past. So that's it, as in a nutshell. Hopefully that was fast enough, but detailed enough to give you a good insight into where we've been and where we're going. And I would certainly welcome any questions or any feedback.
Brandon, could you just talk a little bit more about Humane Education in terms of, are you being invited? Well, first of all, let me say something. Each time we hear you, I think we become more grateful each year for the presence of Friends of MAC. And I just was really interested about how you are interfacing with the community to do this humane education. And like you said, parks, in your narrative, the training sessions at local parks, fairs and festivals. Are you going out and soliciting people to get the invitation, or are they coming in? How do we increase this if we want to increase it?
Yes, ma'am. I mean, it's a great question, and thank you. Obviously, Mac's biggest fans. We adore the folks over there and what they do, and it's very meaningful for us to get to be involved. But in terms of the humane education piece, it's a little bit of both. We do have, organizations will reach out, and say, we would love to have Matt come participate in this event. A couple years ago, there's an event called Wolfstock that happens over at the Canine Group, and it's sort of a big festival, and they asked Matt to come and be there and present. Obviously we took some adoptable animals, and we passed out information about Mac. So we do get those invitations, but certainly we want to look at how do we increase those opportunities to go out. So that's where we'd work really closely with Mac and with our ACOs. And on one avenue of that would be if we know there are certain area codes where maybe we're seeing a lot of getting a lot of intake of loose animals. So maybe there's, we know in a certain zip code, there's an opportunity to go over and talk about, leashing, tethering, or fencing, or, those types of things. And maybe we could go, if there's a, again, provided we can be, it's safe to be there, we could take the Whisker and Wolf wagon over, and we could set up, close to a community park, and then just invite folks over, share information. And part of that too is wanting to, again, collaborate with the ACOs and put together some additional literature about MAC services, and then also translate that into different languages. We know it's not just a native English speaking population that we serve. So we want to make sure that any of the, all the collateral and information that we have, that we're focused, on all members of our community, and making it as accessible as possible to know MAC services and to get the help that they need. I think Dr. Jahangir has lost audio.
What's the matter with that?
He's muted.
Calling in.
He's going to call it,
Oh.
I think.
What?
Are we supposed to call him?
What is going on?
They have taken away my host ability. I can't speak. Can you tell Joe? Joe, they've taken away host ability, so he can't talk.
Oh, wait. Hold on. I think someone gave them to me. Let me see if I can. I may be the.
Yes, if you can move the ball back to Alex's name, Brandon.
To who wants it?
Alex.
And then there's a little circle next to your name, Brandon. If you could move that to Alex's name. There you go.
Yes, ma'am.
Did it work, Alex?
The ball is beside his name now.
Okay, so Joe's troubleshooting.
I can just follow with this.
All right.
So we're better.
Alex, can you just call in?
No,
He's going to fix it.
And Joe's still working on it.
I think his microphone is muted.
Yeah, it looks like he's been muted.
Yeah, he's muted.
Somebody else muted him, I think.
And it won't let me unmute him. I passed the ball back.
Okay.
There it is. There it is. You did it.
Okay.
At least I'm not a cat. Like a video yesterday. There's something going there. Anyway, thank you. So for anyone watching, at least we're not a cat. I will say, if I may, Brandon, my first thing I did as chair, if you may remember, a couple of years ago, was come in and actually had an opportunity to see Mac, and then you and your colleagues were out there, which is really wonderful. So much so inspired my little kids, and just yesterday we got our first pet. We got a little dog.
Yay.
So I'm grateful for what you guys are doing. I know this past year, I'm not the only family that's done that, and I'm grateful for what you're doing. I like the casts, by the way, as an orthopedic surgeon on that cute dog. But you've kind of mentioned this, but is there anything you need from us in this next year, besides just our admiration, which you have?
Oh, well, you're very kind. No, sir. I think from our standpoint, certainly we value the relationship that we have with the Board of Health and the Health Department. Again, we work very closely with Dr. Cannon and Lauren at the shelter. And so, all of these initiatives, we build in concert with them, and certainly, meet regularly, and they always attend our board meetings. So, we feel like we have a great line of communication with the board, just by proxy of Lauren, because she certainly keeps us, updated on any developments. And, you know, again, we always say MAC is the core of our mission. So everything we do is in support of them. So certainly we look to them for guidance, and always want to make sure that anything we do is in lockstep with the mission and vision of the shelter.
Okay. Well, thank you very much. Any other discussions or questions of Brandon? Brandon, thank you and all your colleagues for doing this. No, you can always call on us at any time. Appreciate you doing it. Hopefully next year this will be in person. It will be in person. Let me just make more of a definitive statement. We'll see you in person. See you in person next year.
I like that idea, and I know you guys do too. So anyway, thank you very much.
Appreciate you.
Yes, sir.
All right. Our next topic is our grants, as well as our grants and contracts, applications, and so forth. So, Mr. Diamond, you're on here.
Yes, Dr. Jahangir, there are no applications for this month, so I will move to the grants and contracts. There were 4 that were sent out in the initial packet, and 2 were sent out additionally later yesterday. Items number 1 and 2 are amendments to the Healthy Start, or the Nashville Strong Babies grant, involving the carryover of funds from prior years. Item number 3 was just updating the terms and conditions of our Ryan White Part A COVID-19 response grant. Item number 4 is the TBESC grant, amendment number 7, which extends that for another year. And then the newer items, item number 5 is the amendment to our HIV/AIDS core medical and early intervention grant. And item number 6 is a contract with Nurture the Next. And we've had this in the past. That organization was previously known as Prevent Child Abuse Tennessee. And that one's for $102,809. So I'll answer any questions you may have, or if not, we will request motion to approve.
Sure. I do have one question to follow up on what David, I believe, last board member meeting said. The lack of applications. Is there any concern from the team that will result in, 6 months or a year from now from having lack of programmatic support?
I don't think so, and I don't want to speak for everybody, but a lot of our grants, especially the state ones, are basically the same every year. So any of the applications would be for anything new, and I'm sure, as you know, and as the board knows, we're pretty well at capacity with our ability to add any new programs. Currently during COVID, as well as we are space limited, here at the department as far as trying to add new programs that would add new employees. We just don't have the space here at Lentz or at any of other facilities to accommodate new employees or new programs. So we are continuously looking for funding opportunities. Dr. Larson is usually the one out there finding, looking for opportunities, but right now, I think we're capacity COVID hindered, as well as spatially with our facilities.
Okay. Any other questions? Hearing none, would there be a motion to approve these as presented?
So moved.
All right, Mr. Frederick, there's a second. Carol, second. Okay. Roll call. Any other discussion for our roll call? All right. Ms. Franklin?
Aye.
Dr. Smith?
Aye.
Ms. Etherington?
Aye.
Mr. Frederick?
Aye.
And Mr. Campbell, Dr. Campbell? Okay, and I also aye, so that's everyone in the affirmative. Great. All righty. Now I would like to turn it over to Ms. Lester and Dr. Wright. Ms. Lester, whomever is going first.
Okay, good evening, everyone. We have, of course, given you a written version of our report. And I'd just like to mention a couple of things that are not on the report. We have talked about the strategic plan in the past, and we're nearing the end of completion. We're working on foundational health goals, as well as developing objectives for the goals and for the rest of the actual plan. Also, we have a health equity report that has been put together by Dr. Rand Carpenter, and it's in draft form, and we'll be working to finalize that and have that available within the next few weeks. Still working on our plan for the equity position. I've reached out to several groups of staff, and I think that we will have, once we have the strategic plan finished, we'll have an idea of what this person will look like and how we will utilize their service. I will also probably reach out to some of the board members. We're thinking about putting a small group together with maybe a couple of community members to kind of look and see what their expectation would be for someone in this position. So probably at the next board meeting, we'll have a little bit more details about that. And that is pretty much, except for what's in the report. I especially wanted to mention that our FEMA program and our tobacco program, which the program of Baby and Me Tobacco Free collaboration, was featured in a national resource magazine. And they were just one of 2 programs that was featured, and we're very proud of them. They've done great work, and they continue to work together. That's pretty much what I have. Any questions?
I do have a question.
Sure.
Health equity report, is that a EPI report, a data report, or can you sort of give us a little bit of background as what might be included?
Well, it's really sort of a follow-up to the health equity report we put out in 2015. There were several indicators we were tracking, and I think that this report sort of follows up on it, as well as looking at what some of the objectives, things that we need to continue to work on and what we need to add to it. I haven't read all the way through it. I have glanced at it a couple of times, but I still need to sit down and actually give some feedback on it.
Thank you.
Mm-hmm.
I have a generic question about vaccinations. I don't know if this is a, it's not.
Can I ask you a question, Carol? Before you ask, would you mind if Dr. Wright gave his talk and then see if it answers? Would that be okay?
Absolutely.
Okay.
All right, we'll trade. COVID-wise, we continue to do all of the things that we've been doing. Vaccines is the newest thing, and so give you just a little bit of update on that. Currently, our population here in Nashville, Davidson, is 9.1% vaccinated with at least 1 dose and 4.5% vaccinated with both doses. Our 75 and plus population, though, is 51% vaccinated with first dose and 14% with both doses at this point. We continue to work out of the Music City Center, and weekends are dedicated to our 75 plus, and that will change tomorrow to 70 plus individuals. During the week, we are trying to do, we do some of these 70, what will be 70 plus, but most of that is aimed at our 1A2 group, which is office-based providers. We have also partnered with Meharry. They're doing an event tomorrow and then again on Saturday, 2 different events. The one on Friday is their staff and some population of the community. Saturday is a follow-up to a previous vaccination event. And then we're using a subsidiary there that is also helping us with our 75 plus population in a smaller setting. For those that it might be a little easier to do that way. If we look at data, we've been hamstringed is the best word I can use for being very equitable because of how the state allocation plan has gone. We've really been aimed at medical providers. We will move into schools and they will start taking appointments yet this weekend. They will start vaccinating next weekend. The equity we did release and talk about today at the mayor's press conference, a plan. I think you've been forwarded that plan, and we'll be working from that as kind of our baseline. I think once we get to 1C, which will follow the schools, Basically, anyone that has a risk factor, and I think in our minority populations, I think pretty much all of them have a risk factor, and that risk factor may be simply that they haven't received very good care in the past because of their situations. We are not going to require medical documentation. We will ask about it, but it places an undue burden, I think, on our or some of our populations to go out and get a doctor's note for that. So that's kind of where we're at with vaccination at the moment. We continue to receive a pretty steady supply, and we're going to have a slight increase again starting next week, it looks like.
Can I add one thing to your report about vaccines before you move on?
Yeah.
I also want to highlight we've been giving several thousands of doses to FQHCs, Shalom Health, and this is not us, but the federal government and state are starting to give out to Walmart, but we don't really have much idea what that is. But that's another access point. There's about 5 or 6 Walmarts or Sam's Clubs in Nashville that will also distribute vaccines, just for the group to know. And then the one other part, if I can add around demographics, sorry, I'm jumping here, but I'm going to use my.
Nope, you're good.
Is in the 75 and older group, as I mentioned, about 51% have gotten vaccines. Of the white individuals over 75 in our county, 43%. African American individuals in our county over 75, 29%, and people of Hispanic ethnicity in our county over 75, 35% is kind of those numbers. All right, that's all I got to say. Your turn now. Sorry.
That's okay. The one other thing that we did give vaccine to is we did give vaccine to this week. 2 of our dialysis centers received vaccine. 100 doses each for their patients. Those people are obviously at very high risk should they get COVID, and thought that was a good use of a couple of 100 doses that we had left over in our allocation. So, questions? Carol, did that answer your
Well,
questions?
actually, I jumped the gun before you asked that, but it really isn't specific to the health department, other than in communication with other systems, health systems. I've had several people call who are undergoing chemo, and they have got to go out of county. I mean, they're driving to Lynchburg, they're driving to Perry County, they're driving all over the place as chemo patients. And I just wonder if there's been any discussion on a community basis about how that has.
Alex and I have had lots of discussions on that with the state, and they've been pretty adamant we need to follow the allocation plan.
Yeah, so the phasing, Carol, so I think what you bring up is something that, again, as Gil and I have been talking about, and maybe others on this call. The state's plan is the state's plan. They're the adjudicator of the vaccines. To be able to serve as one of these, even a site, even Metro Public Health serve as a site, or a hospital serve as a site, there's an agreement that you have to have with the state. We have asked several times about exactly the situation you're talking about. In fact, I believe the mayor has reached out about people who are stem cell transplant patients, for instance, or chemo, or and it's pretty adamant. There's not the phasing system is the phasing system, and to our knowledge, there's not a plan to change that, it is way out of our jurisdiction to be able to change that. So
Okay, I get that. I guess I don't understand if we are allowing comorbidities of different sorts to get it. And I'm not asking you to answer.
We're not there yet. That's 1C, which will be right after schools. And then definitely those people that are going through chemotherapy would be definitely in that group. And as Alex said, the allocation plan is the allocation plan, and the state's allocating vaccine based on that to us. So we have to follow that. The reason people are able to go out of community to get that is because they're further along in their plan than we are. And it's because their community is not getting the same uptake that we are.
as of essentially next week, when we start schools, as a Friday, or as a Saturday, excuse me, we're going to be the same age as everywhere else in the state, 70 and above. And the school part of it will be across the state, I believe, the week we start, in about 7, 8, 10 days. So hopefully it won't be that disequity of what's in county and what's out of county, for what it's worth.
Well, I appreciate that, because I'm not asking in terms of why aren't we doing it in this health department.
Yeah.
I'm asking from a public health perspective generally, and whether the discussion has been had, because it just seems a little nuts.
Unfortunately, when they make these decisions, it's kind of like what 3 things do you want to take to a deserted island kind of, and they had to make some decisions, and that's what they ended on. And they had a lot of input from a number of organizations across the state as to how it should be allocated. And so that's what we're working off of.
Thank you.
So, no, I always have questions. And so I do have a couple. And so piggybacking off what Carol just mentioned, I just want to reiterate. So what we have is the state plan that has the phases, and we're trying to think critically about how to make the distribution equitable. But it sounds like from what you're saying that our hands are tied. And so the most vulnerable individuals that are more downstream on the plan, and that's specifically like 2B, 3, 2A, there's no way that they can move up because the state has tied our hands. So we can think about the possibility of a more equitable distribution plan.
Let me talk a little bit about that. First of all, you get to go at whatever phase or age group comes first that you're in, you get to go. So if you're a grocery store worker and you're 65 plus and we hit 65, you get to go. If we get to 1C and you've got any risk factor, you get to go regardless of where your business that you work in falls. So I see 1C holding about half of all of Nashville's population in it. And that doesn't include the people we've already gone through in the first couple phases. Because one of the risk factors is obesity. A third of our county is obese by definition. So there's a wide variety of reasons for those people to be able to go. And as I said, we see a lot of these things that are prominent in those communities, and that would allow them to go sooner. The other thing is that the one thing we do have is the ability to make sure that our allocation of vaccine is getting out into those communities, and that's the crux of our plan, is to get out into churches of color, religious organizations, get out into MDHA housing and such as we get into that phase.
So that's helpful to know. With that, I think that there's sometimes a thought process that communities of color are more vaccine hesitant. And we know that there's vaccine hesitancy across different groups, not just communities of color. And so I want to make sure that we're not using that as an excuse to preclude us from doing whatever we can to reach vulnerable populations. And in our situation, like across the country, we know that African American and Latinx communities. So I look forward to learning more as we move forward with that. But focusing, I heard from Katina Beard the other day. I was in a meeting with Katina Beard, who's the CEO of Matthew Walker. She talked about vaccine readiness, so being ready to answer questions that people might have to get them over the hump so that they're ready to get the vaccine in their arms. The last question that I have is for Dr. Wright or others on the board. What I'm hearing, and I'm getting questions about medical centers and doctors' offices that receive their vaccine allocation, and I'm hearing stories about individuals that are not necessarily on the front lines of healthcare. They may work in offices at some of these doctor's offices and medical institutions, they're not interacting with the public, but that they have access and they've had the vaccine. Can you give us some understanding on what's going on in medical centers, in doctor's offices, about who's getting the vaccine and who's not? Or is everyone being offered vaccine even though they're in an office situation and they're not interacting with the public?
So, hospital systems, I have heard rumors of that also, of some of the executives and such. At the end of the day, if they have open vaccine that needs to be used, they're going to get it in an arm. And I think that that's where some of that has occurred. I can't speak to any specific situation because I'm not aware of all the facts behind it. But in the doctor's offices, what is intended for the vaccine was to be offered to anyone who has direct contact with patients or infectious material. Infectious material would include our, janitors, for instance, housekeeping staff. That type of thing should have been offered because they are at potential risk, and so that would be an expectation. I don't know that you have to offer it to back office bookkeeper, but a majority of the practice would have been offered the chance for the vaccine. Interestingly, we're not seeing as big of an uptake in physicians and other healthcare providers' offices as we thought we might. So.
Thank you, Dr. Wright. Dr. Jahanger or Dr. Smith, I don't know if you all want to weigh in.
My experience has been and I only know of the response at Meharry Medical College. They do have a wait list when, as Dr. Wright kind of alluded to, when they do run out of, or they are, let's say they have given out 4 doses out of the 5 in a vial, then they access the wait list. And those that have signed up on the wait list are then allowed to come in and get called in to come get their shots. But the priority has been given to those that are have high interactions with the public. And then from there, we're following the guidelines. I don't know of anybody that is skipping the line or doing anything of that sort.
Thank you.
All right, thank you. Anything else, Ms. Lester, Dr. Wright, or any of my colleagues? Okay, well, thank you. And my report again is nothing crazy. The one thing's next board meeting. Apparently, all boards and commissions have to go through about a 45-minute ethics training session, and Eric is somewhere here. Inform me of that. We're going to do ours as part of next meeting. So just FYI, I'll keep that to be the only presentation unless there's something emergent or urgent that has to happen. Be ready for a 45-minute lawyer-specified ethics training, which every board and commission is having to go through. So just please be aware of that. I just, again, my big thing is again, thank you to everyone, both watching and at the health department. I'm really excited about what the future holds, with where we're heading with, not only with COVID, but more specifically, actually, the things that are not COVID related. So Ms. Lester, thank you for, I look forward to the new hire that you've talked about, the strategic plan, and accreditation are that's kind of 3 big things that I'd like to see moving forward. And that's it. Any questions of me? I guess this is our opportunity if you have any questions of me. Okay.
I don't necessarily have a question for you, Alex. I'd like to make a request to the public.
Please.
And I want to implore those that if you're seeing large gatherings, I personally had a large gathering in my apartment building not too long ago and made a request very politely to stop it, and they did. I just want people to really do their due diligence and looking out for one another and their neighbors in terms of gatherings during this period of time where I see a light at the end of the tunnel,
Yeah.
but we can't get there without having setbacks like that. So I really want us to do our due diligence and don't be afraid to step in when necessary to do that kind of thing.
Yes, sir. I agree. This is the lowest number of active cases we've had since November, so it's a start. So thank you. All right, and Martha, I don't know if we've made any requests of you. Oh, Carol's waving her hand. Please, Carol.
Yeah, I'm waving my hand. It's not a request so much as it is to ask Dr. Wright, and actually, Alex, you just kind of threw water on the suggestion I was going to make when you said that we wouldn't have any presentations next month, and I understand that. But I also understand, and maybe others who've been involved in the community health worker program, and the efforts that were made earlier in the year to partner with Siloam and get the CHWs. And my understanding is the funding on that is going to run out in May. So I think that given the energy and time and effort and the importance of the program of using CHWs, it would be really nice to hear in timely fashion what's the plan come May and who's going to take the ball in terms of deciding, yes, this program needs to go forward, and who's going to be the lead in making
That's a good point. So I guess I was always an exception, sir. Everything's negotiable. So I appreciate you bringing that up. Do you guys think, I mean, if the board's okay with it, I mean, it's probably be a 20, 30-minute additional presentation and discussion. So maybe a little longer one. Would that be the preference? Because I think the timeline you mentioned, I mean, and Gil and Tina, would that give us enough time to have some information we needed about that? And
it's up to them whether we should do it. I mean, I'm not saying let's do this. I'm saying should we not, however, since we've put so much energy into it.
Well, yeah, we'll have to talk with Jim and finances and stuff to look at where we can fit that and how it might fit into the budget, because the budgets, they've asked us to figure in a 2% reduction into the budget. So we'll have to look at that. And when we can bring that back, if you've got specific things that you want, Carol, just to email us to know about, so we can be sure to include those.
we could talk. Well, Martha, let's put it on the things to maybe to bring up next meeting, and maybe we bring Amy Richards and then others, whomever's working on this issue, to talk about it. And I appreciate you bringing that up, Carol.
Well, I just think that a lot of energy went into it, both on the health department,
That's right.
everybody else's end, and we heard enough about it at the beginning to not just let it kind of evolve away if there's a role that we could or should play. And that's not to try and insert ourselves, Dr. Wright, into the operations. It is simply to just bring it up because the board was so aware of that issue.
Yeah, that's fair. Let's bring it up next month, most likely. Then maybe do a presentation and or discussion. Is that fair? And then whatever specific maybe requests, maybe in the between now and then, dialogue with you and whomever else. Is that good, Carol? Does that work?
Yeah, that's great. Thank you.
Thank you for bringing that up. Anything else? Hearing none, I'm going to adjourn this meeting and not hang up because like I did last time, and bring up the Civil Service Board. Mr. Diamond.
Yes, Dr. Jahan here. At the April 2020 meeting, the board approved the Director of Health to extend COVID-related administrative leave to staff members. We'd like to revisit the approved policy and amend it slightly that was in your packet. Two major, or not major changes, but two changes. One was to delete reference to the Families First Act, which expired December 31st of 2020. And the second one was to make our language more consistent with Metro's civil service policy, which would require employees to exhaust all leave before requesting administrative leave of the directors. So I'm open to having any discussion on that. If not, we would need a request for a motion to approve for this.
And Ms. Lester, I take it you're supportive of this?
Yes, I am. Yeah, we've discussed it.
Just had to check.
Yes. Yes.
Is there any other discussion or motion to approve this?
Motion to approve.
Second.
Okay, that's Frederick. All right. Any other discussion? All right, Ms. Franklin?
Yes.
Dr. Smith?
Aye.
Ms. Etherington?
Aye.
Mr. Frederick?
Aye.
And Dr. Campbell? Okay, that's an aye. All right, me too. Thank you. Motion carries. Personnel changes are listed in the report. Any discussion around the personnel changes? I'd like to highlight we are completed at 55 minutes. So I reserve the balance of our time for our longer meeting next month. Like for this. All right. But in all sincerity, thank you all so much. Hearing nothing, no other discussion, I've adjourned this meeting and see you guys soon. Thank you.
Happy Valentine's
Thank you.
Day.
And it's good because the roads look like they're getting wonky.
Oh, please don't say that. It was 40-something degrees when we got here. Oh, this
That's
morning.
good. Yeah.